So they requested that any of the 8:30 meetings move to noon, move to a different room. So if you see us eating in front of you, please forgive. This is the only second we have to try to grab something, and it beats a power bar. So I want to thank you to those who provided us lunch today. Committee, we're going to begin with the hearing on House Bill 2453 and a bill brief. Jenna.
Thank you, Madam Chair. Good afternoon, committee members, and happy Pi Day to all of you math nerds out there. House Bill 2453 enacts the Dentist and Dental Hygienist Compact to provide interstate practice privileges for dentists and dental hygienists. And this would be fairly standard for your typical compact. So I'll just go through briefly with each of the sections, their main purposes. Section 1 sets out the purpose of the compact, which is to facilitate interstate practice of dentistry and dental hygiene and improve public access to dentistry and dental hygiene service. Section 2 provides relevant definitions for terms used in the compact. On page 3, subsections K and L set out that the compact applies to individuals licensed as dentists and dental hygienists by the state licensing authority, which would be the Kansas Dental Board. Section 3 sets out the criteria for states to participate in the compact. These would include enacting the compact, implementing a background check requirement within a time frame established by the commission, by receiving the results of a qualifying background check, accepting for licensure dentists and hygienists who have appropriate credentials, and requiring professional development. Section 4 is the compact privilege. It sets out criteria for an individual to be eligible for a multi-state licensure under this compact, and those would include having a qualifying license, submitting to their process, and paying applicable fees. Subsection D of Section 4 sets out that a licensee practicing with compact privilege is subject to the state's regulatory authority. And in subsection G, if a licensee's compact privilege is revoked in one state, the individual would become ineligible for compact privilege. Section 5 relates to active military members. It specifies that active military members and their spouses shall not be required to pay the commission a compact privilege fee. And if a state chooses to charge a compact privilege fee, the state can charge a reduced fee or no fee. Section 6 grants a participating state exclusive authority to impose adverse action against a qualifying license issued by the participating state. A remote state would also have the authority to take adverse action against a licensee's compact privilege in the state. Section 7 sets out the establishment and operation of the commission, and that commission would consist of a member from each participating state. The commission would be granted certain authorities, including to adopt rules and bylaws, initiate legal actions in the name of the commission, appoint committee members, cooperate with law enforcement agencies, borrow money, and determine if a state's compact language is materially different from the model. Section 8 would require the commission to develop and maintain a system that contains licensure, adverse action, and investigative information on licensees in participating states. Participating states are required to submit certain data information on licensees to that data system. Section 9 requires the commission to adopt reasonable rules to interpret and administer or implement and administer the provisions of the compact and set out procedures to adopt such rules. Section 10 sets out the rules for oversight, dispute resolution, and enforcement of the compact. Section 11 states that the effective date of the commission would be upon its passage in the 7th member state. Procedures for a state's withdrawal and amendment of the compact are also provided. Section 12 contains a severability clause, which gives instructions to a court interpreting the compact if a provision is held unconstitutional. The commission would also be granted authority to deny a state's participation in the compact if a constitutional requirement of the state is materially different from the compact. Section 13 provides that nothing in the compact is to prevent or inhibit the enforcement of any law or regulation in a participating state. This bill would take effect on July 1st, 2024, upon publication of the statute book. There were no House amendments, and it passed the House on a vote of 119-0.
Thank you, Jenna. Questions for Jenna, committee? Between bites. Okay. Jenna, thank you very much. Committee, we will begin with our proponents. Thank you all for keeping the proponent list short, as we have 2 bills that we need to take final action on after this hearing. Each person will have up to 2.5 minutes. If you don't need that long, please don't take that long. And thank you for being here. We'll begin with Mike O'Neill.
Good afternoon, committee. Thank you, Madam Chairman. I'm here representing the Association of Dental Support Organizations. You've heard from us before on other legislation. And we had this bill introduced on the House side. Those of you should know a little bit about the compacts because you have participated in passing the audiology, speech language, compact, counseling, EMS, nursing, the psychology compact, physical therapy, teaching, and medicine already. And we have two pending this year. This one that we're having a hearing on today, and the House has passed, and you have up for hearing, I think, on Monday, the social work compact. So I don't know that you need a whole lot of background on these compacts. Our interest here in the state and nationally is to create greater access to dental care, and that is particularly acute in Kansas, as I think most of you are already aware. I did attach a map that I hadn't had the opportunity to present to this committee earlier about the change in dental establishments by county 2011 to 2021. And it's a dire situation in Kansas. So our uh, um, philosophy here is all hands on deck, anything that we can do to break down any barriers to getting greater access to dental care in the state. And this is one of those opportunities. This is a joint project by the Council of State Governments in cooperation with the Department of Defense, because there is a military family segment to this to try to assist those as well. I think you'll have written testimony from DOD. In terms of the details of the bill, we do have Jessica Thomas from the Council of State Governments on virtually, so I don't want to take much more time. Here in Kansas, more than 590,000 people live in one of the state's 174 dental health care professional shortage areas as of November 23rd. That's according to the Kaiser Family Foundation. So anything that we can do to increase access to dental care would be greatly appreciated. And with that, I'd be happy to stand for questions at the appropriate time. But I think you need to probably hear from Jessica with Council of State Governments. We'll have more details and have answers to many of your questions.
Thank you very much. Next, we'll move to Kevin Robertson.
Good afternoon, Madam Chair. I'm Kevin Robertson, Executive Director of the Kansas Dental Association, and would like to join Mike O'Neill and ETSA's support of House Bill 2453, the Licensure Compact. This has been a long time coming, trying to create more portability and reciprocity in the dental licensure. I mean, just to compare it to like in college, you have ACT tests and you have SAT tests, and some colleges like one type of test and others like the others. In dentistry, we have 8 different regional exams around the country that all think their exam is the best one. So to come together and say, hey, in Kansas, we're going to allow you to have any test that you might take across the country and allow them to work towards licensure in our state. We think we've gone a long way, and the CSG compact is, we think, will be very helpful. A lot of the stuff that Mike said, don't want to repeat it, but obviously between people that are mobile, we know that the workforce right now is more mobile than it's ever been, and the ability for people to come in and out of the state of Kansas. A study just last year by the American Dental Association showed that of our regional states here, Kansas has the most in migration of dentists. So we are a plus 4.5% of dentists over the last 4 years moving into our state. Colorado is second at 0.9. And then Nebraska, Oklahoma, Missouri all have an out migration. And in my testimony, I kind of have a map there that shows kind of where those dentists are going and coming from. So as we share both Joplin and the Kansas City metro area, we think this would just be very helpful to make that happen. Just want to reiterate that, excuse me, a dentist that might come into our state under the compact, they would have to follow the laws of the state of Kansas. It'd be no different than, hey, I have my driver's license and I'm on I-70 going 75 miles an hour, but when I go across I-70 in Missouri, I got to go 65 miles an hour. So you still have to follow the laws of the state of Kansas, the Dental Practice Act, as you practice, and maintain that. And the dental board, of course, would have authority over those licenses. So with that, I'll be happy to answer any questions when we have that opportunity.
Very good. Thank you, Kevin.
Madam Chair.
Next, we have Tanya Dorf-Bruno.
Madam Chair, members of the committee. Again, I am Tanya Dorf-Bruno. I'm the Executive Director of Oral Health Kansas, and we are the state's consumer oral health advocacy organization. We're happy to be here to lend our support to the dental hygienist compact. The last comprehensive dental workforce study, which was over 10 years ago in our state, found that there were serious gaps in access to dental providers, and it spurred a lot of work over the last decade by many stakeholders to try to increase access to providers. And so we know that this bill will be another really significant tool in the efforts to try to increase that access. One of our top priorities at Oral Health Kansas is increasing access to dental providers. We receive really frequent calls, emails, Facebook messages from consumers all over the state asking us to help them find a dental provider. And that's why it's really easy for us to stand up and support this dentist and dental hygienist compact. The compact really is, as everybody has already said, was going to make it easier for dentists and dental hygienists to become licensed in our state and to begin serving people as soon as possible. And consumers tell us this need is really urgent. As Kevin mentioned, the American Dental Association's Health Policy Institute did a really great study last fall showing where dentists are migrating to and from around the country. I think it's just really interesting to note that Missouri and Iowa and Nebraska are some of the states where dentists move the most often to Kansas. Those are also states that are looking at this compact legislation. So kind of the math works well. Iowa's already adopted it. Missouri has pending legislation. And the fact that we've got dentists moving from those areas makes an awful lot of sense. So we also you might hear from CSG, but might mention that the state of Virginia just passed this and signed it into law. I think it was just this week. So that's pretty exciting. So we would just urge the committee to pass House Bill 2453 to make Kansas one of the first states to adopt it and make it a lot easier for people to access dental providers across the state. Thank you.
Well, that was super quick. Thank you so much, Tanya. Next, we have Jessica Thomas. WebEx. Jessica, can you hear me?
Yes, I can. Can you all hear me?
A little bit louder, please, or maybe we can turn it up here in the room. Can we do that? Let's try again.
Can you hear me now?
We can hear you just fine. Please go ahead.
Okay, perfect. Good afternoon, everyone. I'm Jessica Thomas. I'm a policy analyst with the Council of State Governments, or CSG, and I'm here to provide some educational information about the compact. CSG is a membership-based nonprofit serving all three branches of state government, and all state elected officials are members. We have been a part of the development of all 16 active licensure compacts, and we partnered with the Department of Defense, ADA, and ADHA to develop this one. I won't summarize the compact again. You should have my full testimony, but I do want to point out that, as mentioned, this will come into effect once it's enacted by 7 states. At this point, it has been enacted by 5. Iowa, Tennessee, Virginia, Washington, and Wisconsin have all enacted it, and it has pending legislation in 12 states, which include Colorado, Nebraska, and Missouri. And I'm happy to remain on for any questions about the bill.
Thank you very much, committee. I would draw your attention to the proponents that are in written only, and we will open up for questions for the verbal proponents. Any questions? Senator Petty.
Thank you, Madam Chair. And this is for Jessica. Jessica, thanks for joining us by WebEx. I was involved with the teacher compact last year. And so I just wanted to, and I read in your testimony, I think, and the others, is that this compact, one of the things is that every state that passes it, it has to be basically the same legislation. Would that be correct?
Yes, that is correct.
Thank you.
Additional questions, committee. Senator Stephan.
Thank you. I know Jessica just kind of went over it, but she articulate the list of states that are currently in this compact. And then if somebody wanted to tell me how we get out of the compact if we so chose.
The states that are currently in the compact are Iowa, Tennessee, Virginia, Washington, and Wisconsin. And I can answer your second question as well. You get out of the compact the same way that you are getting into it, which would be to pass it through your state legislature.
Senator Alley.
Thank you, Madam Chair. Now, you probably are the one to answer this, Jessica, but are we reciprocal? In other words, if a Kansas dentist wouldn't want to go across the line to Oklahoma, I know Oklahoma's not in the compact today, but if they were to join the compact, would a Kansas dentist have the same rights as the Oklahoma dentist?
Yes, it would work both ways.
Thank you.
Additional questions, committee? I have a question. My concern always with compacts is the tail wagging the dog. And the compact says everybody's going to stay on the compact test to do X. And maybe Kansas doctors or dentists don't want to do that. So it sounds to me like since we have the exit, that you should be able to, you can say you can get out of it. But can you also amend it? Can dentists say, we don't want to adhere to take that test or this test? Kevin, could you maybe address this?
Well, I can address part of that. So, for example, if you're a Kansas dentist and you want to go to Missouri, so your primary license would still be in Kansas, and then you would have a remote license in Missouri. So your licensure would all the requirements that Kansas has for your licensure, that's what you have to complete. You don't have to complete different licensure requirements that might be in Missouri. Now, that also works the opposite way. If we have different requirements, if you're a Missouri dentist and you're coming to Kansas and you have a remote license in Kansas, and we might have something a little bit different. For example, we have some ethics requirements. Not every state does, but most do. Some states have requirements with dentistry. They have to do CE for opioid and narcotic addiction type stuff. We don't have that requirement. So there would be some requirements maybe that you wouldn't do, but you would always be tied to the requirements of your state as far as your licensure is concerned. Jessica, I believe I have that right, correct?
So the benefit to the individual dentist is?
Well, I mean, if you're looking at, again, Missouri and Kansas, there are a lot of Missouri and Kansas dentists along in that Kansas City area that are currently dually licensed. But you have to actually complete all the requirements for both your Missouri license and your Kansas license. If you're going to another state, for example, let's say you're going to Utah or something, when I apply for that license in that state, I have to apply for that license, even if it's made easier by something called licensure by credential, where if you have the spotless record, you can still get into that state. Kansas does that now, but you still then would have to renew that license individually in every state you have. Under the compact, they're keeping that information. So if you're doing a background check and fingerprinting and all those types of things, that information is kept in the one location, the central location. And now if I want to extend to another state remotely, that information is already housed by the compact. And so that the state would get it from that, and you wouldn't have to continue to repeat that
Great.
as you move to other states.
Thank you, Kevin. Committee, any other questions for the conferees? Senator Steffen.
So a person does end up having to have a license in each state they're practicing in.
Yeah, well, yes and no. It's called a remote license. So this, for example, if you're from Missouri license is your primary license. You come to Kansas, you now have a remote license to practice. And Kansas still has authority over that remote license. And if they take that away, if you have a disciplinary action in Kansas, for example, that's going to ding the compact and everywhere else you are. So we feel, the Dental Association feels like we're still protecting the patients because you cannot practice in all those remote states if you have any disciplinary actions anywhere else that you might have a compact license, compact privilege.
But they still have to fill out an application. You're just saying that it's kind of acts as a repository of the application data.
No, you're absolutely correct. I keep looking back here because Lane Hemsley, the executive director of the dental board, is with us in the audience. But yeah, they would still have to complete an application. I don't know for sure, and this is maybe where Jessica could help. I'm guessing it might be a standardized type application through the compact, but I don't know that for sure. You know, Lynn?
And what's it going to cost us annually, or initiation fee and such, to be in this?
That's the fees would have to be established by the Kansas Dental Board. So I don't know what those fees would be at this time. Oh, you mean as far as the dental fees? I don't know. That we have to, again, I would also ask Jessica for clarification on that if she's still online.
I think when you said us, Senator Stephan, you meant we, the state of Kansas. Kevin, the question was we, the state of Kansas.
I believe that's going to be based on a fee that might be established by the compact committee. So those first 7 states that pass the compact will form a central committee, and we hope to be one of those 7 states to be involved in that. But they would establish what those compact fees might be. And the dental board would establish what the fees would be for the dentists that would be in the compact. I suspect that whatever fees the dentists that have a compact privilege would also, then that money would also go towards, you know, our commitment and our being in the compact.
Senator Petty, last question.
So Kevin, just stay there. So, and this is just a follow up. I'm assuming the advantage from this bill is that we're a compact state. If I am coming to Kansas from a non-compact state, then I would have to, it's potentially that I would have to meet certain criteria to be able to meet the Kansas license requirements to practice as a dentist. That if I'm coming from a compact state to a compact state of Kansas, then I just fill out an application.
That's generally correct, yes. It'd be
Thank
a much simpler process. Last question.
Committee, that concludes the hearing on House Bill 2453. We will now move to possible action on Senate Bill 488. And I believe we have some amendments. Yes, Jenna, would you do a quick overview?
Thanks, Madam Chair. Senate Bill 488 would expand the scope of the Inspector General. It would amend the statute. It would allow the Inspector General now, in addition to investigating Medicaid, would also be able to investigate state cash, food, and health assistance programs. For cash assistance, you can think TANF. For food assistance, you can think SNAP. And for health assistance, that would cover Medicaid, Medicaid, the state children's health insurance program, as well as the state employee health program. And it would amend and strike some references to enable the Inspector General to be able to implement and administer the enhanced powers through the bill.
Questions for Jenna, committee? Seeing none, I have a First Amendment, and there may be others. And we had talked about the very large fiscal note on this bill and had asked if, and everybody has the amendment, correct? Eileen passed out? To reducing that to no more than 10 FTE. Then we could see how things go, which would, on the fifth page, would authorize no more the 10 full-time employees in fiscal year 2025 in the Office of the Inspector General, giving us an opportunity as the Senate committee to review how things went. Any questions about it? Yes, Senator Blasey.
Thank you, Madam Chair. Actually, I really appreciate this amendment. My big concern was the fiscal note as well, and 30 FTEs. And so I appreciate the effort to go down to 10, but I think it go a little further. So I might make a substitute motion going down to 5 FTEs.
After discussing with you earlier, I would agree with that, Senator Blasey, and I would consider that a friendly, I guess that would be a substitute amendment. Is that correct, Eileen? Okay, any additional discussion of this amendment? Yes, Senator Petty.
So just to remind me, Madam Chair, am I talking about the original amendment or are I now talking about the substitute amendment? I'm asking questions.
The substitute.
Okay, so we're now.
We have not had a motion, a second on the First Amendment. So just, I'm as the individual of the first, otherwise we would have had, I would have had to remove my motion. I would have had to remove the second and go to the substitute. So never actually made the motion. We were just discussing this. So this is a substitute amendment in the discussion. Is that correct, Eileen, for procedure?
Thank you, Madam Chair. Just for clarification purposes, if we're taking the 10 FTEs and turning them into 5, would you also make the subsequent 50% correction to the budget?
Yes. And are you agree with that?
That would be correct.
Yes. Thank you. So I will move the.
Stop.
Oh, yeah, I'm sorry. I didn't know you were back on discussion. Go right ahead, Senator.
I had a
Petty.
clarifying question. I still have.
No, that's all right. Go ahead.
So now we're talking about about $800,000, not to exceed $800,000. If we're looking at the substitute motion, would that be correct?
I think Eileen is calculating half that number, so it would be a little less than that, but go ahead, Eileen.
Thank you, Madam Chair. It would be $775,000, $775,456.
Senator Petty, do you have another comment?
Yes, I do. Thank you. So I'm just going to comment on the fact that this it is less positions. We still are growing government. We're growing, and there have been great additions made to the Attorney General's office this year in our budget that we just discussed yesterday on the floor of the Senate. But this is growing the Medicaid Inspector General's office by 5, which and increasing the budget by I'm going to just go ahead and say almost $800,000 because it is almost $800,000, and at the same time we are putting this in place over dealing with an agency that already has all of these positions within it. The Department of Children and Family already has the has investigators. It does audits. It has all of these positions, and so we are actually creating new positions to do the same thing. The DCF currently investigates and prosecutes welfare recipients' frauds in all public assistance programs, including food assistance. Their fraud investigation unit is comprised of a director, a chief investigator, and a fraud hotline receptionist, as well as 16 fraud special investigators. So now, if this legislation passes, we're going to say now, okay, we're going to put, and basically 6 people over this, where we already have these many positions, and 4 benefit eligibility experts create. so we're creating now 5 positions where originally we were talking about 20 to do the work that's already being done by DCF. I will also add that currently, when you look at the number of recipients that are receiving assistance through the state, through these federal funds, the total number of those that there's any kind of fraud involved is a half of 1%, a half of 1%. So we're going to spend $800,000, create 5 new permanent positions to do the work that is already being done in the Department of Children and Family. This is definitely government overreach and misuse of our state funds. And if we want to be good fiscal stewards, this isn't it.
Eileen, you have a comment?
Yes, Madam Chair, I just wanted to make sure that I called the committee's attention to the fact that this is within the limits of appropriations. So if there are no dollars appropriated for this program, it would not go forward.
Thank you. Steve, would you come to the microphone, please, Inspector General? Could you address what you do that would be different from the other offices that were mentioned?
The Inspector General's office, with given this additional authority, would also be doing audits of the programs. I believe it is. Maybe I need to just lean in closer. The purpose of this is to add, so we have additional audit staff. Right now, DCF does not audit those programs. They depend on federal audits that are very sparse and seldom happen. It would also some of these staff would also help us with our Medicaid portion we're currently doing, and we need additional resources to do Medicaid fraud examinations. And one of the reasons there's not a lot of fraud found, this percentage that Senator Petty gave, is because there's nobody really looking that closely at it. The problem that DCF investigators also have is they don't have law enforcement authority to do some of the things that our people would be able to do. We're currently working joint cases with them on Medicaid and food assistance fraud, and we're able to do things that they can't do because we have full law enforcement authority to do those things.
Am I correct in understanding, because I know that there was a doctor in the last couple of years that was committing fraud having to do with charging Medicaid, charging Medicare for services that were actually not rendered.
Right.
And this is also within your purview, correct?
That's right. That would allow us to look at situations like that where we have doctors who are committing fraud, as well as dentists and pharmacists and other people. We're not just focusing on DCF operations at all. That's a sideline piece of it, but it would allow us to do more to help them be successful and bring more of those cases forward, but also to allow us to look at physicians and what have you that are also committing frauds that also are not being adequately reviewed and audited.
Thank you. Committee, do we have other questions on the amendment? Senator
Thank you,
Alley.
Madam Chair. Steve, would you remain up there, please? Thank you. I seem to remember in the paper, my local paper, that within the last year, we found $16 million worth of fraud in Medicaid. Is that correct?
Yes, sir. Involved the transitional medical program. It was people that were on the system that shouldn't have been. It's a 1-year time limit program, and they were on it for some of them for maybe 5 or 6 years.
And do I understand it was your office that found this fraud?
Yes, sir.
Okay. Are there any programs that are out there today that are not being audited that your additional support staff would help?
The Medicare program is a good example. Health and Human Services at the federal level could be doing that. Kansas does not get a lot of attention from the federal offices because they focus on states with higher population density. So consequently, we're largely ignored as an entity. Also, Department of Agriculture does not do a whole lot toward audits or reviews either of those SNAP programs and TANF programs because, again, ours are relatively small in comparison. So consequently, we don't get a lot of attention from that.
Steve, could you also help us? I seem to remember a document that in the last 3 years, how much did your office discover on waste in the Medicaid program?
We identified over $211 million in waste. We also identified, I think it was $16 million in overpayments. We also identified, I believe it was $11 million in potential savings that could be had if the departments took our recommendations for changes.
And this request that you have was for 30, is that right? And then they
Originally requested 20 FTEs, and that's been cut down now, I understand, to 5.
to 5.
Yes, sir.
And the total dollars for this 5 are what, that
About $800,000.
800,000?
Yes, sir.
But if we could find and stop $16 million worth of fraud in one case, it would definitely be worth spending that kind of money, I believe.
Yes,
Thank you for your help.
Senator Stefan.
Thank you. And I do think it's important to keep in mind that a lot of what they do is discover fraud and waste for other agencies. But then it's the other agency's responsibility to claw it back. You know, the important number is not how much they found, it's how much they were able to recover. And I think that's the number we need to focus on going forward.
Senator Holscher.
Thank you, Madam Chair. Oops, there we go. While I have some concerns still with the underlying bill as far as the parameters and the scope, and you and I have talked about this, I just want to say I'm very appreciative of this amendment that you brought forward as far as the adjustments being made, because that does seem much more appropriate, especially after what we saw with some of the budget issues yesterday. So I will be supporting the amendment. Thank you.
Senator Petty.
Thank you. And I think Senator Stefan said it very well, that what's clawed back. So there was the question asked earlier, Steve, about the $16 million. So how much have you actually collected?
We're not able to collect any of it, but what we did was we stopped the hemorrhaging because we got people that were on the program that should have been taken off, were removed from the program. So there's immediate savings there. And I believe that we identified in the report is about 1.6 million was saved because they were able to immediately remove those people. And it's capitation payments. It's not taking money away from those individuals. We're paying capitation, which are the monthly premiums that go to the insurance companies, the MCOs. It stopped them from being unfairly enriched because they were getting capitation they didn't deserve for people who weren't even using the program. They didn't even know they had the services, but because of a flaw in our system, we were continuing to pay capitation out that shouldn't have been paid out.
So I think this is a good, important point, because I think in your testimony, you said that you would be able to pay for these positions when in fact that's not actually factual. It would be coming from state general fund. I would share with the body, woman, as Senator Stefan had mentioned about whatever we've been able to claw back. And so if we want actual current information about DCF, that in the current FY24 fraud claims total over $1 million. And that's based on 178 cases. And I think it's important to realize it's 178 cases out of 135,000 recipients. So that's where we talk about those very, very small percentage. And those cases have actually have gone to prosecute, or of those 178 cases, only one of those cases was referred on further for criminal prosecution. So if we're talking about recouping, that's already occurring under the current program with specialists that are familiar, which is not true with the Medicaid, in the Attorney General's office, with specialists that are already familiar with the federal guidelines. And I don't think I have to go into the extensive information about what it takes to be familiar with federal guidelines and the operation of those programs. But that's why the staff at DCF is fully trained in SNAP and TANF and applications, and what's required. This would not be true of those that would be potentially be hired under this program. So we're putting in place duplication. In fact, assuming that there's extensive fraud when we already have information that is not true, and when it has been discovered through the DCF staff that's already in place in all of those positions, that it is investigate it and follow it through. Again, I think this is a waste of a total waste of state funds.
Thank you, Senator Petty. Any other questions regarding the amendment? Seeing none, I move my amendment. Do we have a second? Second. Moving his substitute amendment and second it. Okay. So, committee, all in favor say aye. Aye. Opposed? Now we are back on the bill. Do we have other amendments? Senator Stephan.
Thank you. I do have an amendment. I'm going to amend my amendment. So I'd go ahead. Well, it's not. I was backed into a corner.
I was told it had to be in writing.
As part of my amendment was just like what we just did. So the only part of my amendment that's in play now is that on page 9. The rest of the amendment is deleted because I do think we're heading down a path that could be very, very healthy in that we're looking and saying, boy, this is growing government. We want to make sure it's effective. We want to make sure there's a return on investment. Within the bill is terminology that mandates reporting on by the Inspector General back to us, i.e. the legislature and others. And so I think with this amendment, with sunsetting this in 4 years, what we're really doing is kind of keeping it in the spotlight. So we're looking at this, every year. We know this is something we need to look at. His reports become more important. We can analyze his reports each year. And again, remember that this is an expansion of powers. This expands his powers into investigate and audit all state cash, food, and health assistance programs. So what we're really looking at doing is expanding and then potentially retracting. So I put this out for your all's thought, put our heads together, see if we think this is a good idea as a way to maybe not just grow government and then forget about it and let it stay there for in perpetuity. So my thought is to put a 4-year sunset to guarantee that we keep our eyes on this new expansion, analyze the data that comes back, and then move forward accordingly. In 2 years, we may look at the savings we had. Mr. Anderson may be back wanting the extra employees, and we may be eager to give them to him. So I think this is just a great way to keep a spotlight on a program that could reap incredible benefits.
Any questions on the amendment? Senator Blasey?
Thank you, Madam Chair. Just to clarify with the presenter of this amendment, you're just saying page 9 is the only one left in this amendment that you're actually proposing. It's the sunset expiring July 1st, 2028. That's your motion? Thank you, Madam Chair. I strongly support this. I really appreciate him trying to ensure that we review this. I think oftentimes the legislature enacts legislation without going back and to see if it's actually effective. So I appreciate this motion and will strongly support it. Thank you.
Senator Petty?
And thank you for this motion. However, Senator Stephan, you've referred to providing information on an annual basis, but there is nowhere in this bill where that does that.
Well, I was told by people smarter than I am.
You want to turn on your mic?
So if Jenna would like to comment on that, because I did ask for language requiring yearly updates, particularly in regards to the sum saved clawed back. And I agree with Mr. Anderson's evaluation. When you stop a loss, you're saving money. So I think we certainly need to keep that in mind.
Well, I would just say there's no place. Okay, Jenna, do you want to respond to that?
Thank you, Madam Chair. On page 7 of the bill, this is current law. It would be subsection I, requires the Inspector General to make annual reports, findings, recommendations regarding their investigation, and reports into fraud, waste, abuse, and illegal acts related to the programs, to the post auditor, the Committee on Ways and Means, the Committee on Appropriations, the AG, and the Governor. And then the reports are required to include This would say, it would be amended by the bill to include the number and type of audits conducted and the dollar savings, if any, resulting from the audits, healthcare provider sanctions in their aggregate, and a detailed summary of the investigations undertaken in the previous fiscal year. And if you do a simple Google search, you can find those reports online. If you type in like Kansas Medicaid Inspector General, they'll come right up.
Thank you, Jenna. Other questions?
Thank you. that was still my question going on, Madam Chair. So in the original bill, however, unlike the Medicaid Inspector General, there are current audits going on. There are current investigations going on by the DCF. So I'll ask Revisor. Is there any distinction within this bill as to what the current department is doing as opposed to what would be supposedly new? Just by the line saying the Inspector General? Okay, so the Inspector General has to make those annual report.
Could you say that
I'm
in the mic? Thank you.
I'm sorry, Madam Chair. Okay, so on page 7 in subsection I, it says the Inspector General shall make annual reports, findings, and recommendations regarding the office's investigations into reports. So that means that the ownership of those reports and the responsibility to provide those reports rests with the Inspector General. The reporting function, I don't know the statutes off the top of my head, but I would be willing to bet that DCF has its own reports that are required for their functionality with their investigations into fraud. This would be something totally separate and responsible from this functionality through the MOIG.
Thank you, Eileen.
So, but I guess and thank you for that clarification, Eileen. I guess my question then for the committee to consider is the fact that, okay, we have fraud investigation results from DCF. We have them on an annual basis. We can look back at them. We know how many clients there are that's already being provided by DCF. They already have a division. So how would when the inspector, if this legislation passed and the Inspector General did an investigation or provided information, how is it discerned from what actually DCF has done, and that there's actually any new, as Senator Alley referred to, any new fraud that actually was discovered by the now commitment of 5 new positions and $800,000 more per year when we already have 20 positions that we have in government paying for that?
Mr. Inspector General, could you come forward and address that? And I may say this, we need to move on because we have another bill that we have to take final action on. Go ahead.
Of course, anything that was being completed by my office that my office published would be something we'd report out on. We would not overlap with DCF's reportable incidents. I see there's a very clear distinction because, like I said, a lot of this work would be done in the form of audits, which DCF does not do. And some of these staff members would also help bolster our Medicaid investigations and things, work that we do on that. So I don't see there's going to be an overlap, and we certainly would never claim any work that DCF had accomplished on our reports. Thank you.
Which would give you the responsibility to account for those additional dollars that we would be giving you for the FTE.
That's correct.
Correct. Okay. Senator Petty, one last statement, please, and then we need to vote.
Okay. I'm sure at this point people already have made up their minds. You may sit down. Mine's not for yours. But this is giving the Office of the Inspector General unfettered access to personal information of anyone that either has filled out a application, has received any kind of assistance, or is no longer receiving any kind of assistance, as well as any state employee under our state health program. So it's to me a very broad overreach that we should be very concerned about. And if your constituents are interested about their protecting their personal information, this is not the way to do it.
Senator Petty, I believe I have an amendment to address that very thing. Are there other amendments, committee? Okay. And Eileen, you would read that amendment.
We got to make the motion and vote on it.
Oh, I thought we did already.
I don't think
Forgive
so.
me. Thank you.
Yeah.
Uh,
I'll make,
mo-
I'd
move
like
your
to make the
amendment.
motion that we amend the bill by adding on page 9, the P, the amendment made by this act to this section shall expire on July the 1st, 2028. Thank you.
We've heard the amendment, the motion. Do we have a second? Senator O'Shea seconds. All in favor say aye.
Aye.
Opposed? Now we can move on. I have an additional amendment. Are there other amendments, committee? All right. Eileen will explain.
Thank you, Madam Chair. The amendment that you're receiving now would limit the access of the Inspector General. If you look at on page 2 of your current bill, the original bill, health assistance means the Medicaid program, the state child's health insurance program, and the state employee health benefits plan is established by KSA 7537, 162. So it was my faulty understanding that we wanted to strike all of this with relation to the state employee health plan. In actuality, what we're trying to do is limit the ability for the Inspector General to access the medical records of patients and who use the state employee health plan. So on page 2, we would unstrike the language that says, and the state employee health benefits plan, all the way through the end of line 13. And then the next page of the amendment that you've got now, where you see the gray highlighted language, that language was stricken in the original bill to give the Inspector General that sort of unfettered access. The language would read, access to contractor or health care provider files shall be limited to those files necessary to verify the accuracy of the contractors or healthcare providers' invoices or their compliance with the contract provision or program requirements. No healthcare providers shall be compelled under the provisions of this section to provide individual medical records of patients who are not clients of the state Medicaid program, the state Medicaid program, or the state Children's Health Insurance Program. That's the limitation there that would have been stricken, so it would remove that limitation. What we're going to do is restore that language to replace the limitations on access truly to just those files and access to those provider information that's necessary to carry out the mission of the office. And then on page 7, it's the same thing. Access to contractor files shall be limited to those files necessary to verify the accuracy. Same thing. No healthcare provider shall be compelled to provide individual medical records of patients who are not clients of such a program or programs. And again, we're going to unstrike that highlighted language and re-add it as a new subsection 6 to make it a separate provision because it would contrast with the new subsection 5. And I can answer questions.
Senator Petty.
So Eileen, on that page 7, is that word which? Is that actually put in, or is that not, that it's in the box?
It actually would be replacing, be inserted. So it would be access to contractor files, which shall be limited to.
Okay, thank you. And so the gray box on page 5 and the gray box on page 7 are actually in the bill, back in the
They're
bill.
in the bill as being deleted. We're going to undelete them and restore that language.
They're restored to the bill.
Right. That's current law now. The bill would remove those restrictions. What we're going to do is amend the bill to reinstate those restrictions.
Additional questions, Dr. Steffen.
As a physician who is a a private and small businessman and as a patient, I really, really like your amendment very much. I agree with it completely and will support it.
Committee, I move my amendment. Do I have a second? Senator Stefan, all in favor say aye. Aye. Opposed? Committee, we are back on the bill. Do I hear a motion on the bill? Senator Stefan.
I make a motion that we pass the bill favorably as amended from the committee.
Second. Senator Blasey, all in favor say aye. Aye. Opposed?
No.
The bill passes.
And Madam Chair, I just wanted, with the addition of Senator Stefan's amendment, I talked it over with Gordon this morning. There's some behind the scenes things that make it a little bit complicated. So we would just ask for a little bit of leeway in drafting that report to make it correct on the backside. If that makes
Absolutely,
sense.
Jenna. Thank you for watching out for that. Committee, my intention was for us to take final action on Senate Bill 371, except I believe we have to be on the floor at 1 o'clock. Is that correct?
No, we have education. We have education.
Oh, we have education. Is there anybody that has to leave by, yeah, we do have education. Anybody who has to leave by before 1:30? Okay, in 2 minutes. So I don't know, we can do it in 2 minutes, Senator, but we'll go quick. All right, let's open the final action on Senate Bill 371. Do we have any amendments? Okay. Senator Holscher?
Yes. No, I'm fine. Yes, as Eileen is handing this out, I'll just go ahead and give a brief explanation. As y'all may remember, SB 371 expands the Kansas Silver Alert Plan to provide public notice of missing persons 18 years of age and older who have an intellectual disability. We had several supporters of the bill. We had neutral testimony. There was one opponent testimony. Of concern, as detailed in that testimony, was line 15, page 1, and the definition of the term intellectual disability. After the hearing, we got all the interested parties together to discuss the situation. I believe they met with you, Chair Gossage, and fortunately, they were able to come to a consensus on the wording, which is reflected in this amendment. And I believe if you look there on the page, it defines intellectual disability. And Eileen, please interject as you are the expert, or Jenna, or as far as the definitions here as updated. And I will add here, there was an email that was forwarded to everybody in advance of the meeting. And with the agreed upon language, Bob Stewart said on behalf of the KBI, we concur with the proposed amendment language and would withdraw any previous opposition testimony to SB 371. We appreciate the work done by all the interested parties to address our concerns and look forward to working with you all in the future as we together strive to protect Kansas. So there you go.
I just want to echo that, yes, they did all meet in my office. You remember when we were having the hearing that I asked that they all come together and to discuss this about the best way to approach it. And we did all come together. They said they had the amendment, and I suggested that they get with the member to bring the amendment. So thank you, Senator Holscher, for doing such. Senator Blasey?
Thank you, Madam Chair. I was just going to echo what you've stated and Senator Holscher. And so I appreciate the work on this amendment, and I will second it.
Okay, committee, we have the motion and we have of the amendment, and we have a second. All in favor say aye. Aye. Opposed? We're back on the bill. Do we have any additional amendments? Yay! Okay. All in favor of I need a motion on Senate Bill number 371 as amended. Senator Holscher.
Well, as appropriate on this day of Interhab Advocacy Day. So good planning on your part. You did that on purpose, right?
Of course I did. No, honestly, I really did. That's the truth. Okay, so go ahead.
I move that the committee pass out SB 371 favorably as amended.
We have a second from Senator Petty. All in favor say aye. Aye. Committee, we are adjourned.